Welcome to our video on the causes of lower abdominal cramping pain. This is a common problem that many people experience, but it can be caused by a variety of factors. In this video, we will explore the most common causes of lower abdominal cramping pain and discuss possible treatment options. So, if you're experiencing this type of pain, stay tuned, and let's get started. Lower abdominal cramping pain can be caused by a variety of factors, including menstrual cramps, gastrointestinal issues, and urinary tract infections. In this video, we will explore the most common causes of lower abdominal cramping pain and discuss possible treatment options. Menstrual cramps. One of the most common causes of lower abdominal cramping pain is menstrual cramps. Menstrual cramps occur as the uterus contracts to shed its lining and can be felt as a dull or sharp pain in the lower abdomen. Menstrual cramps can also be accompanied by other symptoms, such as bloating, fatigue, and nausea. Treatment for menstrual cramps includes over-the-counter pain relievers, such as ibuprofen or naproxen, as well as heat therapy and relaxation techniques. In some cases, prescription medication may be necessary to manage severe cramps. Gastrointestinal issues. Another common cause of lower abdominal cramping pain is gastrointestinal issues. Gastrointestinal issues, such as constipation, diarrhea, and gas, can cause abdominal pain and discomfort. Gastrointestinal issues can also be caused by certain foods or medications or by underlying medical conditions, such as inflammatory bowel disease. Treatment for gastrointestinal issues includes making dietary changes, taking over-the-counter medications, such as antacids or laxatives, and, in some cases, prescription medication. Urinary tract infections. A third common cause of lower abdominal cramping pain is a urinary tract infection, UTI. UTIs occur when bacteria enter the urinary system and infect the bladder, urethra, or kidneys. UTIs can cause a variety of symptoms, such as a frequent urge to urinate, pain or burning during urination, and lower abdominal cramping. Treatment for UTIs includes antibiotics to clear the infection, drinking plenty of water, avoiding irritants, such as bubble baths, and wiping front to back to help prevent UTIs. Other possible causes of lower abdominal cramping pain include ovarian cysts, endometriosis, and pelvic inflammatory disease, PID. Ovarian cysts are fluid-filled sacs that can develop on the ovaries and can cause cramping, pain, or discomfort. Endometriosis is a condition in which the tissue that normally lines the uterus grows outside of it, causing pain and cramping. PID is an infection of the female reproductive organs that can cause pain and cramping in the lower abdomen. Other conditions that can cause lower abdominal cramping pain include irritable bowel syndrome (IBS), inflammatory bowel disease (IBD), and diverticulitis. IBS is a common condition that affects the large intestine and causes symptoms, such as abdominal pain, cramping, and diarrhea. IBD includes conditions, such as ulcerative colitis and Crohn's disease, which can cause inflammation and cramping in the lower abdomen. Diverticulitis is a condition that affects the large intestine and can cause cramping, pain, fever, and constipation. Certain medications can also cause lower abdominal cramping pain as a side effect. These include nonsteroidal anti-inflammatory drugs, NSAIDs, birth control pills, and antibiotics. It is important to note that lower abdominal cramping pain can also be caused by serious conditions, such as ovarian or colon cancer. If you have persistent cramping pain or other concerning symptoms, it is important to seek medical attention to rule out any serious underlying conditions. Treatment for lower abdominal cramping pain will depend on the underlying cause. Over-the-counter pain relievers, such as ibuprofen and acetaminophen, can help to alleviate mild cramping pain. For more severe pain or underlying conditions, a healthcare provider may prescribe stronger medications or recommend other treatment options. Summary. In summary, lower abdominal cramping pain can be caused by a variety of factors, including menstrual cramps, gastrointestinal issues, and certain medical conditions. It is important to seek medical attention if you have persistent cramping pain. We hope you found this video informative and helpful in understanding the causes of lower abdominal cramping pain. Remember to always consult with your doctor if you're experiencing any type of pain, as they will be able to diagnose and treat the underlying cause. Be sure to subscribe to our channel for more health-related videos and leave a comment if you have any questions or suggestions for future videos. Thanks for watching. Hit that subscribe button for more expert insights and practical tips to help you feel your best.